Hi, I'm Ellis, Senior Genetic Counsellor with Genea. Welcome to our presentation on GeneSyte, Genea's non-invasive prenatal screening. This video is designed to give you further information on GeneSyte to help you in your practice. Not all NIPS tests are the same, so we hope this information will help you understand how GeneSyte delivers more for your patient. GeneSyte is a non-invasive prenatal screen, also known as NIPS or NIPT. NIPS is a blood test that can be done throughout pregnancy from 10 weeks gestation. NIPS measures the cell-free DNA in the peripheral bloodstream. During a pregnancy, the cell-free DNA is made up of both the pregnancy as well as the mother, and it is this total cell-free DNA that we measure in GeneSyte. We're able to ensure that we're measuring the cell-free DNA of just this pregnancy, as the cell-free DNA from each pregnancy is cleared from the bloodstream within hours of birth. GeneSyte uses next-generation DNA sequencing for analysis. This method counts the amount of cell-free DNA coming from each chromosome with around 20 to 30 million counts. If there is more cell-free DNA coming from a particular chromosome, then it is likely that this is due to the pregnancy, specifically the placenta. GeneSyte can also test for sex chromosome conditions, but the sex of the baby can be withheld if you or your patient prefer. GeneSyte can be used in most pregnancies, including multiples, IVF pregnancies, surrogacy, or consanguinity. If you have any particular concerns about your patient, please contact our team and we can discuss your patient's individual circumstances. GeneSyte results will generally be reported within 5 working days and very often in less. This quick turnaround time is very valuable to patients who find waiting stressful. Most results will be reported as no aneuploidy detected. There is a small chance of a false negative result in the order of less than 1 in 100 of known trisomy 21 cases. While an NAD result is very reassuring, it must be noted that this is a screening test, not diagnostic, so the results must be interpreted with other pregnancy variables, such as ultrasound. The major advantage of GeneSyte is its much increased detection rate, as well as its much reduced false positive rate compared to traditional combined first trimester screening. The detection rate of trisomy 21 is greater than 99%, and the detection rates for both trisomy 18 and 13 is greater than 98%. If an aneuploidy is suspected, then it is best to have a chorionic villus sampling or an amniocentesis to confirm the finding. Occasionally, there can be a difference in the GeneSyte finding and the actual chromosome status of the fetus. This is because there can be a variation between the fetal chromosomes and the placental chromosomes. This is known as confined placental mosaicism. The difference in findings can also be due to the mother having a chromosome variation herself. Genea's combined false positive rate is 0.2%, which compares to 5% for traditional combined first trimester screening. In rare cases, 0.1% of the time, GeneSyte will not be able to provide a result. This is 20 to 30 times less often than other NIPS providers, and it's a very important factor for you in providing the clinical outcomes for your patient. If we're unable to provide you with a result, we will contact you so that we can discuss the implications with you. It is Genea's policy that no patient ever be charged if we are unable to provide you with a result. As GeneSyte uses next-generation DNA sequencing, there are rare occasions when we may find an underlying chromosome condition that was unexpected. We will contact you with these incidental findings should they occur. The final point for you to consider is testing right for the woman in front of you. As with all prenatal diagnosis options, there will be women who prefer not to have any testing performed. However, given the ease, popularity, and the ability to find out the gender of the pregnancy early, some women may feel pressured to have NIPS performed. It's important for that woman to consider, though, what would she do if she were to find that her baby has a chromosome condition? What would she do with that information? And does she really want to know that early in the pregnancy? Some women like to know early so that they can plan, whereas others may decide that they do not wish to continue the pregnancy. It's important that you have discussed these options with your patient ahead of time. We have a decision aid on the patient side of the portal in order to help your patients make the decision that is right for them. Genea has a strong history in prenatal diagnosis, and our fully integrated team of genetic counsellors and scientists are happy to be of support to you. We believe in providing you with the most accurate and up-to-date information, so genetic counselling is available to your patients free of charge.